Cruciate ligament disease and cruciate ligament rupture is a really common problem in dogs, and if your dog has just ruptured its cruciate ligament, then today I'm going to talk about the best ways to go about treating that, depending on how big they are and depending on how bad the damage is. You know, cruciate ligament, it's one of the most common causes of persistent lameness in dogs, especially larger breed dogs, and there are some breeds that are more likely to get this, but we do see it from every breed, from small to large. So there is a reasonable chance that your dog may become affected with cruciate ligament rupture. Cruciate ligament rupture, it can come in a couple of different varieties. So we can get a partial rupture where there's just a little bit of damage, but the ligament as a whole is still intact. And then we can get complete rupture where there's no ligament left. And that's when there's a lot of instability in the joint. So the joint moves in ways that it shouldn't do. It's really painful and it's a real problem. So rather than being a traumatic event, which is really what happens in ACL rupture in people, so anterior cruciate ligament rupture, the ligament in dogs tends to actually just weaken over time. So you absolutely might have a case of a dog jumping over a fence and getting their leg trapped and ending kind of dangling by their leg that can cause this rupture if they're falling from a height or if they get knocked over on the road, then that can cause an acute kind of traumatic rupture. But by and large, most of these cases tend to be just a weakening of the ligament over time. And then with an incident that isn't particularly severe, so it's not a big traumatic event, the cruciate ligament will just kind of fray and then completely rupture. Now, the reason that this is important is because actually around 30 to 50% of dogs will rupture their other cruciate ligament within about 12 months of that first cruciate ligament going. And that's obviously really important because we're potentially talking about expensive surgeries to fix this, and it may be that you need to pay for a second surgery within 12 months of that first one. So, you know, that's something really important to consider when you're deciding which route is going to be manageable for you and is best for your dog. What's the best way to treat cruciate ligament rupture? Surgery is way too expensive and the lower priced places have long waiting periods. Now, there's a couple of different ways that we can manage cruciate ligament rupture in dogs. We can manage it conservatively and we can manage it surgically. So with surgery, about 90% or over 90% of dogs will have a good outcome, and that means that they'll have a minimal lameness and they'll return to their normal function. So that's, you know, really encouraging. Now, for dogs that are under 15 kilos, actually about 85% will have a good outcome with conservative management, and I'll go into what that means in a little bit. For dogs over 15 kilos, though, the success with conservative management falls to around 20%. So you can see that if we're not doing surgery in our larger dogs, so our dogs over 15 kilos, we can expect only about 1 in 5 to have a really successful outcome, meaning that they'll have little lameness and they'll be able to return to normal function, compared to 9 out of 10 dogs with surgery having a good outcome. So, you know, that's really a strong argument that our bigger dogs, our larger dog breeds, really need to have surgery for this disease. Now, surgical management, like I say, will almost always result in a better outcome. You know, faster recovery as well is going to be a case with less arthritis and pain going forward. You know, although there's maybe less of a difference in these small breed dogs and also those with just a partial rupture as well. Now, there have been a number of different surgical techniques over the years, and this is maybe something where we're getting into kind of the expensive nature of this surgery. So there are ligament replacement surgeries, and there are something called osteotomies, where we're actually cutting bone and we're changing the angles and the mechanics within the joint itself. Now, the cost difference between these techniques can be significant, and they're really just a reflection of the technical aspects of the surgery being performed, the equipment needed, the training that needs to go on, any implants that are being used. So there might be plates, there might be titanium wedges. So there's a lot of complexity within some of these advanced osteotomies compared to maybe the ligament replacement, where we're putting a nylon or another kind of temporary, well, not temporary, kind of a replacement, fake ligament on the outside of the joint, which is much technically less demanding, but really in general, osteotomy, so the more advanced procedures, they are felt to produce a better result. They seem to produce a faster recovery, so dogs using their legs much more quickly than with the lateral suture techniques. You know, although there's not completely clear data to back this up. Irrefutably, that's the general feeling amongst the kind of the profession, and it's certainly something that I've seen as well in the dogs that have these osteotomies. They're walking, within a few days, they're walking really well. We still absolutely need to protect them. We still need to go through the period of rest and confinement just to make sure that while everything's healing, there's no extra strain that could cause problems with the surgical site. But really, osteotomies are, generally preferable. Now, they do come at a bigger cost, so that's not to say that the ligament replacement techniques are worthless. I think they're definitely superior in our large breed dogs to doing nothing, but that's what you really need to think about when it comes to kind of looking at just the cost of surgery, what actual surgery is going on and what's the likely benefit of having that surgery compared to one of the other ones done. Now, if you can't afford surgery, then, for smaller dogs especially, conservative management is absolutely appropriate. And what that really involves is complete rest for about 6 to 8 weeks. And that's kind of confining them so that they can't jump anywhere, they're not running around, they're not kind of doing the wall of death in a pen outside, they've not got a really big garden where they can actually exercise anyway. We really need to confine them to a small room or to a crate for 6 to 8 weeks, only going out to the toilet, to walk on a lead, really just to rest that joint so that there's as little as possible forces going through that knee. We're going to give painkillers as well, obviously. We need to lose weight if a dog is overweight. We can give physiotherapy. We want to just maintain the kind of the normal motion within the joint. We don't want it to completely seize up. And we also really need to maintain the muscle mass as well, because it's very common that we get a lot of muscle loss in a dog's leg following rupture of their cruciate ligament. And maybe you want to consider a knee brace as well, although, I'm uncertain how much benefit these actually are. And I discussed that in the Dr. Alex Answers episode number 5, if you want to learn more about knee braces after cruciate ligament rupture. Now, for large dogs then, conservative treatment, it will likely result in an improvement for most, but this improvement really is unlikely to be even nearly as good as surgery. But, if surgery is an absolute no-go, if there's no way that you can afford it, then, conservative treatment is something that we're going to obviously be wanting to do. Don't expect really big things with it. Complete rest is absolutely essential, and painkillers again is really essential, because we don't want our dog to be in pain. Gone are the days where we think if a dog's in pain, they'll rest their leg, they won't use it, and that's a good thing. No, we need to be resting them ourselves, we need to be confining them, and we need to be giving them painkillers. Now, one thing I would caution against is using conservative management in the first instance and then surgery if things aren't improving as well as we would expect, especially if we're monitoring them for more than just a couple of weeks, because by this stage there's going to be a lot of damage within the joint already and you're not going to get the full benefit of surgery. So I think if there's a possibility, or if there's a likelihood that you can afford surgery and you're thinking that it will be the better thing for your dog, then go for it sooner rather than later. Don't wait until you've already got a lot of joint damage and the conservative management isn't really working before jumping to surgery, because like I say, you're not going to get the best bang for your buck. And then once kind of a dog has improved, be that through the conservative management or after surgery, and they've gone through their immediate post-operative care and the instructions that your vet has given you, then we're going to need ongoing care to help keep arthritis at a minimum and to also try and reduce rupture of that other knee, ideally. So that's going to involve weight management again, so making sure that our pets are nice and lean rather than overweight, which is a really common problem. You can use a ramp for the car or for the stairs so that they're not having to jump up. You can use pain control, avoid slippery floors just so that they're not slipping over and hurting themselves. Definitely you don't want to be ball chasing, because that involves really rapid acceleration, changing direction, stopping, all kinds of things that put immense strain through the joints. So there's a whole load of other things. Now, if your dog has had cruciate ligament rupture, then I'd encourage you to sign up to my arthritis mini course, which you can find on ourpetshealth.com/resources. And that really will take you through some of the things that we can be doing to help keep our dogs as comfortable as possible and minimizing the effects of any arthritis that they are suffering from.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.